This is going to be a short introduction to anemia, and then we're going to have quite a few lectures more about anemia. So first, what is anemia? Anemia is defined as a decrease in the number of circulating red blood cells. So less red blood cells in your blood vessels is anemia. Now it's hard to calculate just the number of circulating red blood cells, so practically for diagnosis, we look at hemoglobin or hematocrit levels. And so hemoglobin, just remember that red blood cells contain hemoglobin. Hemoglobin is the protein that binds oxygen. So we look at the levels of hemoglobin and use it as a surrogate for levels of red blood cells. And for men, it's less than 14. And if it's females, then women, then it'd be less than 12. Hemoglobin is less than 14 for men, less than 12 for women, is diagnostic of anemia. If you want to look at hematocrit, that's another measure. Hematocrit is just basically you take hemoglobin times 3 and you get hematocrit. Okay, so symptoms of anemia pretty much arise from poor oxygen delivery to tissue. So you have tissue not getting enough oxygen, and you're going to get symptoms. You're going to get fatigue and shortness of breath. So fatigue is overall just tissue is not getting enough oxygen, so you're tired, you're working harder. And then shortness of breath just comes from your diaphragm, that muscle for your respiratory system. That diaphragm is not getting enough oxygen, and it causes you to get shortness of breath. And that diaphragm actually uses a ton of oxygen. When your breathing mechanics, your diaphragm moving up and down uses up a lot of oxygen. Pallor, you can get pallor. This is just poor oxygen, just not enough hemoglobin. You have low levels of hemoglobin in your blood because you have low levels of red blood cells, and so you get pallor, especially of your eye. So you can see here, this the eye. Remember the conjunctiva covers both the eyeball itself as well as this inner layer. See, it's very pale here, so that's pale conjunctiva. Finally, you can angina. Angina is just remember exertional chest pain. Why would you have exertional chest pain? Remember, that comes from when your heart tissue is not getting enough oxygen and it's getting a little ischemic. And so a lot of times we think of angina just due to a blockage of the coronary artery vessels. But if you have low levels of blood, you're still going to get poor oxygen delivery to the heart tissue. And your heart tissue is not going to get enough oxygen. You're going to feel that pain. You're going to feel angina. So this is especially in patients with existing coronary artery disease. So you get a double whammy. You get coronary artery disease, already decreased blood flow, and then you have anemia. So like whatever blood is getting to the heart muscle is not carrying enough oxygen. There's not as much red blood cells in there. There's not as much oxygen. So fatigue, shortness of breath, pallor, angina. Now the easiest way and the way we classify anemia is by the size of the red blood cells, and that's the mean corpuscular volume. So MCV, mean corpuscular volume. And so we can classify it as microcytic, where it's less than 80, normocytic, where it's between 80 and 100, or macrocytic, where it's over 100. And the reason why this happens, okay, first of all, microcytic anemias are due to impaired hemoglobin production. Okay, impaired hemoglobin production. So for each red blood cell, there's less hemoglobin. Now, a general thing is that our red blood cells like to maintain an appropriate level of hemoglobin concentration. So each red blood cell likes to have a nice similar concentration of hemoglobin. So if you have less hemoglobin, what's going to happen to your red blood cell? It's going to compensate for the less hemoglobin because you have a problem making it, and it's going to become smaller, so you get a microcytic, smaller red blood cell. Next is a normocytic anemia. There's no problems in the hemoglobin. The concentration is the same. The problem and the reason why you get less red blood cells is you get destruction of red blood cells, or you have poor production. So you're either getting destroyed, or you're just not making them. Then you get a normocytic anemia. There's no problem between the ratio of the red blood cells and the hemoglobin. It's more just that red blood cells and hemoglobin are both getting destroyed or not getting made. Finally, macrocytic anemia is due to impaired red blood cell production. However, hemoglobin production is fine. So now you have more hemoglobin per each red blood cell. So now you're going to have to make a bigger red blood cell because there's more hemoglobin for each red blood cell. You want to maintain that concentration. You get a bigger red blood cell overall. You get macrocytic anemia. So again, macrocytic due to impaired red blood cell production with normal hemoglobin. Normocytic is due to red blood cell destruction or problems with its production. And finally, microcytic anemia is problem with hemoglobin production. So that's it for our overview. The next couple lectures are going to talk about microcytic, normocytic, and then macrocytic anemias.